In Wales, the scope of optometric care being offered is being expanded, in part thanks to the work of today's contributor.
There is a revolution going on in Wales at the moment, and now the contracts come through. What we're seeing is that lots and lots of optometrists are upskilling. They're investing their time to become or to be able to deliver extra services in the community. We're seeing practices and practice owners investing in their practice equipment and training their staff in order to deliver these services. We still do normal sight tests, sell glasses, contact lenses, that kind of thing, but we also do emergency eye care. We'll also be able to deliver glaucoma services in the community or across Wales.
Craig first qualified as a dispensing optician, then converted to being an optometrist. He joined his regional optical committee 5 years later, after becoming a practice owner and seeing the impact it could have. He chaired the contract renegotiation subcommittee for Optometry Wales in 2020 to 2022 and is now the chair of Optometry Wales. One of the great successes of optometry in Wales is their glaucoma service, where optometrists are monitoring stable patients in the community. This was spurred by a lot of patients not receiving glaucoma follow-ups.
And this is because fundamentally in the hospital they didn't have enough visual fields kit or people to take corneal thickness measurements, etc. But these are part of optometrists' core skills. And so we said to the health board at the time, we can actually fill those in for you, collect that information and send it into you so we can start seeing your hospital patients out in the community.
In September 2014, a pilot was launched in 6 practices, one of which was Craig's. They would take Goldman tonometry, central corneal thickness measurements, Humphrey visual fields, disc assessments and more, all to be sent to the hospital.
Patients that hadn't been seen for a long, long time were being seen and either told, yes, everything's okay, or we could red flag patients whose pressures have gone up dramatically or fields have changed quite a lot.
Through the pilot, they ran a patient questionnaire that showed that patients were exceptionally happy with the services that they received.
So it's essentially showed that the delivery of these traditionally hospital-based services in the community were far preferable to the patients, were deliverable within optometrist core practice, and could quickly increase the capacity in the community, which was then leading to better outcome measures. So the health board, we ran this from September to December, and the outcomes were so strong that they got in contact with the Deputy Health Minister, Vaughan Gething at the time, who I invited into the practice to meet some of the patients who told him how excited and how great it was, and they've got to get this to continue. And so he then found some funding for the health boards to allow this to continue. And in early 2016, this was adopted as a pathway within an eye investment health board area.
After this success, Craig looked into their local macular referral structure. Previously, people with suspect AMD were going into hospital.
The actual macular clinics they were running, maybe out of 20 patients, 3 or 4 had treatable conditions and the rest had to be filtered elsewhere. So we introduced the first in the kind in the UK, an ophthalmic and diagnostic treatment centre to tackle these delays. It's the first in the UK for a high street optician to provide initial screening and for referral for people with symptoms of wet AMD, and for the NHS staff to come from the hospital and deliver the treatment for the condition in that same high street location. That was in 2016, and it's still running really successful today.
Thanks to this, referral to treatment time came down from 19 weeks to just 3 weeks.
Through that process and my work then with Optometry Wales, we then could go to Welsh Government and say, look, there are lots of pathways, there's lots of things that we can do as optometrists to deliver this care into the future. And this is where the new contract and the contract renegotiation process started to begin, and where we started to reevaluate how services could be delivered and how they should be delivered in order to meet future demand and capacity issues.
But why get involved in the first place? What does Craig get out of it?
If I see something not working as it should be and I can influence to change it to make it better, then I will. And that's just, I guess, the person who I am. I think it's really important for us all to take ownership and responsibility for the changes that are happening in our stores and locally, and be able to, because they deliver services for our patients and our practices and is the betterment of optometry as a whole.